Pre-oxygenate the patient with 100% oxygen. Select the appropriate tube size for the patient. Remove the device from the protective cradle and carefully check for any signs of damage. Lubricate the back of the iGel on the non-inflatable cuff and ensure no lubricant is in the cuff. Lubricate each side and the tip of the non-inflatable cuff. Grasp along the integral bite block and face the cuff outlet toward the patient's chin. Insert the iGel into the mouth in the direction of the hard palate. Glide the device down and back along the hard palate with continuous gentle pressure until resistance is met. Tape to secure or use a commercial tube holder. Connect the iGel to a BVM and assess for breath sounds and air entry. Confirm tube placement using end-tidal CO2 detector or esophageal bulb device. Monitor oxygen saturation with pulse oximetry and heart rhythm with ECG. It is strongly recommended that the airway, if equipment is available, be monitored continuously through capnography and pulse oximetry. Re-verify iGel placement after every move and upon arrival in the ED. Document the procedure, time and result, success, on or with the patient care report, PCR. It is strongly recommended that an airway evaluation form be completed with any BED use.